بسم الله الرحمن الرحيم. يعطيكم العافية طلاب سنة ثالثة. إن شاء الله هذا تسجيل لمحاضرات أول محاضرات الكلاس 3 وكلاس 4 cavity preparations. رح نبلش فيهم إن شاء الله ندرب عليهم بالمختبر، ورح يكونوا أول تدريب إلنا للحشوات التجميلية اللي أخذناهم إن شاء الله محاضرات النظري، بس هاي المرة رح نطبق عملي على الأسنان. definition أخذتوه أنتو في المحاضرات السابقة. تعرفوا class 3 is a smooth surface involving proximal surface of anterior teeth, while class 4 usually is similar to class 3, but we have involvement of the incisal edge. Clinical technique for any cavity preparation that we need to restore in the clinic. We start with giving anesthesia so that we can guarantee a patient comfort and decrease the salivary flow. Then after that we need to do our occlusal assessment. This is very important in class 4 because class 4 is larger than class 3, so most likely we have part of the incisal edge is missing, so we need to do our assessment and see how much of the structure is missing and if we have a space to add our restoration. Then we need also to determine the design of the restoration depending on the occlusion and also adjust the restoration function. So the assessment is very important for class 3. As you see in the first picture, most of the tooth is missing, so this will make a complication for us if the patient has opposing occlusion that, for example, has tilted teeth. So those tilted teeth will take some of the space that we will do or we will place our restoration in that area. After we determine our occlusal assessment, we should do our shade selection. Shade selection is very important because those are anterior teeth, and as you see in the second picture, second photo, the teeth doesn't have one color. Usually we have more opacity toward the cervical area and we have more translucency in the incisal area. So if you have a large class 4 cavity preparation, you might need to choose more than one shade to do your final restoration. After shade selection, we should do our isolation to increase or enhance the vision and make more effective bonding. And then we will start our tooth preparation. After we finish the preparation, we will do our pulp protection if needed, if the cavity is very close to the bulb. And finally, we will do our restoration. Now, type of approach is very important for anterior teeth. We have two types of approach, either from the labial surface or facial approach, we call it, or from the lingual surface, and this is called the lingual approach. Now, for us, the lingual approach is preferred because it's more aesthetic and it will conserve the facial enamel. If you conserve the facial enamel, then the staining will be less visible if it occurs on your restoration, and we should usually use this approach unless it would remove more or excessive amount of tooth structure. In this case, we need to use the facial approach. Now, facial approach is usually used when the caries is located on the facial surface, if we have some problem in the alignment of teeth, for example, tilted teeth, and also we use it for replacement of an old restoration that has a facial recurrent caries, for example. So you can use either facial approach or lingual approach. If you can use the lingual approach, this is better, but if you have other problem like caries and recurrent caries, then you can use the facial approach. Now for teeth preparation, usually we have three designs for preparation. The first one we call it conventional design. This is usually used for class 3 and it's indicated for restoring the portion of a cavity that extends to the root surface. What we mean with conventional is the conventional design that we use for amalgam. You remember amalgam design that we have butt joint. The walls of amalgam they have cavo surface margin that equal to 90 degree. Usually the gingival floor is perpendicular to the long axis of the tooth, and we usually need a uniform depth. So this is the conventional design. You can imagine that the class 3 on the proximal surface of anterior teeth is exactly like a class 1 on the occlusal surface of posterior teeth. So this is the conventional design. Now the outline form, we will start with it with choosing the bears. The bears that is preferred for class 3 and class 4 usually is round bears. You can use all dimensions, half, 1 or 2 round carbide bear or diamond bear. And usually we enter in the area of caries by 0.75 millimeter in depth. And after we make our outline, we should remove the caries. The bulbal depth of caries is dictated by the caries lesion itself and the existing restorations. So those are the steps, if you remember, and when we speak about principles of cavity preparation. Usually we have 6 principles of cavity preparation. We start with the outline, removal of caries, retention, resistance, convenience form, and then finishing. So we will speak about each step one by one. If you look at the photo on the end of the slide, you can see in A that we have the cavity or the caries lesion on the root surface. B show you the depth or the outline form that we make. Look at the cavity, it's exactly like a class 1 cavity but on the proximal surface. We have outline form with a depth of 0.75 millimeter, and in C you can see that we remove the remaining caries and the cavity is now clean. Then after that we will go for retention. We will see if we need more retention. Now retention in the conventional design, we usually use grooves, and those grooves they decrease the effect of polymerization shrinkage, and they can increase marginal seal by resisting tooth flexural forces. As you know, on the cervical area of the root, there is many forces that can work on this area, most likely the flexural forces. So those flexural forces will try to debond your restoration. So making those grooves will help you to retain the restoration and increase the retention. Now the bears that we use for the retention groove, usually we use the smallest round bear, quarter round bear. The position usually on the internal portion of the external wall, and it should be 0.25 millimeter from the root surface and 0.25 millimeter in depth. Now all those steps will be explained in the lab, and I hope that you can do it in the lab. So it's better for you to visualize the area of retention and how to place the retention groove by yourself in the lab. So as you see in the first photo that this is a cross section of the tooth structure, and you can see that the retention groove they are placed in the internal portion of the external wall, either from the incisal or gingival, and they are inside the dentino-enamel junction, and they are 0.25 millimeter in depth. Now the location, the exact location is of the retention groove is the bisector of the angle formed by the junction between axial wall and external wall. So if you draw a line parallel to the external wall and another line parallel to the axial wall, and then take it a bisector between them, then this is the right position of your retention groove. And this should be explained inshallah in the lab. Now the other design that we will speak about is called beveled conventional. So the conventional was on the root surface. Beveled conventional is usually indicated when we restore a large carious lesion or replacing defective restoration in the crown. And usually it has the same design of conventional. However, we will use some beveled enamel margins. So the area, the kypho surface margin will be 45 degree on the beveled area, and the area that doesn't have bevel will be 90 degree like amalgam walls, and the external wall should be perpendicular to the enamel surface. And you can see exactly the shape of the cavity in this photo. You can see that we have enamel bevel, and the other part of the cavity is conventional design. Now the outline form, we start with any size round bear. either carbide or diamond. Usually the point of entry should be within the incisal-gingival dimension of caries lesion or defective restoration. As you know, in the proximal area, usually the caries is or starts underneath the contact area and extend gingivally toward the embrasure area. So in this area, you should start your entry to the dental caries. The instrument should be held perpendicular to the enamel surface, as you see in the photos. The neck of the bear should be as far as possible in the embrasure, and you can see that we will try to tilt the bear toward the adjacent tooth, and the neck should be in the embrasure area. This will help you in preserving more enamel on the lingual surface of the tooth that you are preparing. Now, if you compare the photo in the upper part of the slide with the one on the lower side of the slide, you can see that the first one on the upper side, it's the correct entry. As we said, that the bear is as far as possible in the embrasure. However, in the second photo, you can see that the bear is exactly perpendicular to the lingual surface. This will remove more enamel on the lingual surface, and this will make unconservative cavity preparation. It will enlarge your cavity preparation more than you need. So try your best to make the entry as conservative as possible to protect more enamel on the lingual surface and make your cavity or the restoration as small as possible. Now about the axial wall should be 0.2 millimeter into dentine, as you see in the photo. Also, the shape of the axial wall, it should be exactly following the normal external tooth contour and dental enamel junction from the incisor-gingival and facial-lingual. So it should be outwardly convex. As you see in the photo on the right side, the axial wall is not flat, it's convex toward the outside surface, so it follows the normal contour of the tooth structure. And this is to preserve the bulb and prevent any damage to the dentinal tubules in the dentinal enamel junction. So try your best always. Any part of any cavity preparation, it should be usually following the external tooth contour from all dimensions. After we make our outline, as we said, we remove the caries. Undermined enamel can be left in non-stress area. Not like class 1 and class 2, we usually have more compressive forces. That's why we don't leave any undermined enamel. However, in a class 3 and a class 4, if you don't have occlusion on any undermined enamel, you can leave those enamels for bonding. They will help you in retaining your restoration. After removing the caries, we will go for retention. And usually we use enamel bevel or enamel or retention grooves. Now, enamel bevel is very important in retaining or increasing the surface area that we are bonding. If you compare in this diagram, if you compare A with B, you can see that in A we have a bevel, and this bevel exposes more enamel or more ends of enamel rods that you can use them for bonding. However, in B, you can see that you can only bond to one side, the proximal surface of enamel rods, and the outside enamels, you can't use them for retention. So the importance of using bevel is increasing the surface area of enamel rods that you can use them for bonding, and this will retain your restoration better than non-beveled area. So again, bevel increase the surface area we usually use the flame shape or round diamond burr to place the bevels. We tilt the burr 45 degrees to the external test surface, and then we will place our bevel, and you will do this in the lab, inshallah. The width of the bevel usually between 0.25 to 5 millimeter, and we place the bevel on all accessible enamel margins except the gingival area. And this is very important because the gingival area is very thin. The enamel at the gingival area is thinner than enamel on the incisal area. So to prevent the removal or accidental removal of enamel on the gingival area, it's better not to place bevel on those areas. Also, we should avoid enamel bevel on the lingual surface if the margin is subject to occlusion. That's why we say in the beginning, make your occlusal assessment. If there is a contact on the margins of your cavity, it's better not to place a bevel, because the area of the bevel will have a thinner part of the composite restoration, and with occlusion it will fracture afterward. So don't place bevel if you have occlusion on the lingual surface. Now, what about the grooves? Do we need grooves to retain the restoration in beveled conventional? Usually they are not necessarily unless the cavity is very large. You can place them exactly like in the conventional part. They are usually along the incisoaxial and the gingivoaxial line angle. As you see the blue line in this photo. The bear is the same, the smallest round bear that we have. They should be 0.2 millimeter inside the dentinal enamel junction, and the depth should be 0.25 millimeter. And the location is exactly like before. You will take a line parallel to the external wall and another line parallel to the axial wall, and take your bisector that is in the red color arrow. Then you will have the location or exact location of placing your bevel. Your groove. Now, some consideration for class 4 cavity preparation. If we are using beveled conventional for class 4, usually we need a deeper bevel between 0.25 to 2 millimeter, depending on the part of the tooth structure that is missing. Also in class 4, large class 4, you can use retention grooves. The same properties. Also, you can use undercuts and dovetails that we use in class 2, as you remember. You can see that this photo that we have a dovetail, the one in the middle, we have a dovetail. We can usually also use the undercut in the dovetail to help in retention. And the last photo, in the lower part of the slide, you can see that we use pins. Pins usually like a small metal زي الوتد تقريبا. We place it inside the dentine to help us in retaining the restoration. The only problem with pins that they are non-aesthetic in anterior area, and they might make some damage to the tooth structure. However, all those retention means you can use them in large cavity, in large class 4 cavity preparation. Now the last design is the smallest design. We call it modified conventional. We usually use it with the small and moderate lesion or vault designed to be as conservative as possible in the crown. So as you see in the first photo that we have a small class 3, and the second one we have a small fracture class 4. So usually we have all enamel margins around the defect or the caries. We usually scoop or concave scoop out the caries, so the design is usually called scooped or concave design. The cave surface margin could be 90 or more. It's not important actually to measure the cave surface margin in this design. The external wall has no shape and only include the caries or defective restoration. So it's very simple design. Just remove your caries or place your restoration, and that's it. The outline form, we usually use round bear, any size of carbide bear or diamond bear. Point of entry is the same within incisogingival dimension of carious lesion or defective restoration. The instrument should be perpendicular to the enamel surface and the neck of the bear as far into the embrasure as possible. So it's the same instruction as we said before. The axial wall here doesn't have any uniformity in depth, so don't worry about the axial wall to make it uniform as in the previous design. After we make our outline, we should remove the caries as before. Undermined enamel, you can leave it in non-stress area. Retention, usually it's very simple design, so you might use some bevel or a flare, or you might not need any of them. Now, sometimes we have a large cavity that extends between the root and the crown, so we can use combined design. For example, this tooth in this diagram, you can see that we have cavity that extends from the root surface to the crown. So you can use two design. The part of the cavity situated in the root, you can use the conventional design, and the part that is situated in the crown, you can use the beveled conventional design, and we call this combined design. So you need to modify your design depending on the cavity, on the position of the caries, and if you have a fracture, if this fracture is extended to the incisal edge. So you can modify your design depending on your need. After we finish our design and cavity, making our retention, finish the cavity wall, we should do our pulp protection, and we have a lecture about pulp protection. If we need to place calcium hydroxide in deepest area, or if we have a bulb exposure, we should place it in the deepest area. And usually we use resin modified glass ionomer as a liner. This material has a chemical bonding with composite, and it is a good liner material, and it will protect the calcium hydroxide from the acid etch that is placed under before we place the composite. So it's very important to use resin modified glass ionomer liners with composites. Restorative procedure, we usually use composites. It's prohibited or contraindicated to use any other type of restoration. This is an aesthetic area, so composite is the most common material that we are using. However, composite is contraindicated for restoration extended on the root surface. So on the root surface, as you see here, that we have a gap that will form in this area because of polymerization shrinkage will pull out the composite away from the dentine on the root. So in this situation, it's very important to place the resin modified glass ionomer, as we said before. Resin modified glass ionomer will seal this area, and it will decrease the stresses placed by the polymerization shrinkage caused by the composite. So again, resin modified glass ionomer will decrease the micro leakage on the root surface and decrease the gap formation and prevent recurrent caries formation. As you remember from the lecture of the glass ionomer that it has a fluoride release, so this will help in preventing recurrent caries. Now let's speak about the restoration part. We will do that also on the lab. As you remember in the when we give the lecture of bonding technique to tooth structure, we have three steps to have a good bonding to the tooth structure. First, we need to prepare the surface, and this is done by acid etching of the tooth surface to clean the surface from smear layer and open the dentinal tubules for dentine or removing part of hydroxyapatite on the enamel surface. So this is the first step, acid etching. After that, we need to place our bonding material, and we speak about the type of bonding material. If you remember, we have total etch, we have self etch. It depends on the material that we have in the lab. We will place our bonding agent, and then cure it depending on the manufacturer instruction. After that, we will place our composite restoration, build it in increment to decrease the effect of polymerization shrinkage, and finally have the shape and the normal shape of the tooth structure. We will check the anatomy, the function, and the color of the restoration. In class 3, usually we use a clear Miller strip as a matrix. You took 2 lectures about matrices. So for class 3, it's preferred to use the Miller strip. And usually we place a wedge between the teeth gingivally to seal the cervical margin and protect the adjacent teeth. Um, uh, uh, So the first step is etching, as we say. We follow manufacturer instruction. We usually place the etching 0.5 millimeter beyond the cavity margin. We usually leave it for 15 to 30 seconds. Then we will wash the tooth structure and dry it. Dentine should remain moist. So if we will dry the tooth structure after etching, it's better to use cotton roll, not the air syringe, to prevent the collapse of collagen fibers that we speak about it before. So if you use air syringe on dentine after etching, you will collapse the collagen fibers and this will affect your bonding. So use only the cotton belt. After that, we will place our bonding agent according also to the manufacturer instruction and according to the type. Then we will air dry to remove any solvent present in the bonding agent. As you remember, we have different type of solvent. We have acetone, we might have alcohol or water. So return back to the lecture to see what type of solvent and how it affects your bonding. After that, we will use the light curing for 10 to 20 seconds to convert the bonding agent from liquid to solid material. And then we will place our restoration. We will contour it using the resin placement instrument that you have, and then we will adapt and hold the Miller strip and cure the material. So in the first, in the photo on the left side, you can see that we place our composite, and in the photo on the right side, you can see that we hold the Miller strip tightly around the tooth and we press more on the cervical area, and then we will place the light cure and cure the material, so the material will take the contour of the tooth structure that you have. After that, we will finish and polish the restoration, and you have different kind of burrs for finishing. You have strips for interproximal area, you have the discs, and also you can use the scalpel. All of those will be explained in the lab. We should maintain the proximal contacts, which slightly separate the teeth, aid in creating proximal contact with resin, and usually we use finishing burrs, stones, or scalpel for recontouring of the proximal area. So your proximal area should have the right contour. It should not be concave or convex with more or excessive composite restoration, and you can use all kind of finishing burrs and scalpels to have the right contour. And those are the finishing disc and finishing strips. You will use them in the lab. We have different types. Now, when you use the polishing or finishing and polishing strips, you should use it in S motion, as you see in those photos, because this will prevent removing more of the contact, and you will preserve the contact area that you created with composite. If you use it in a U-shaped motion, then most likely you will remove from the proximal area, and this will create an open contact for you. So be careful when you are using these strips. Now the scalpel is very good instrument to finish at the cervical area. However, you need to be careful when you're using it. The cutting edge should be positioned toward the occlusal, not the gingival, to prevent any trauma to the gingiva. And the polishing disc is very good for polishing the lingual surface and also the labial area. And this is your final restoration. As you see it, we have a good contour, we have a good finishing, good polishing. There is no underfill or overfill of the restoration, and the restoration return all the missing part of the structure to the normal shape and normal anatomy. Now, what about class 4? It's the same instrument we will have. Usually, class 4 fracture, simple fracture, we usually make repair. The patient will come with a fracture part, so we will repair them with direct technique. We usually use conservative treatment with composite. It's better than indirect restoration. As you see in this photo, we have large part missing of the structure. So repairing this part with composite direct restoration is more conservative than making a crown for this tooth and using indirect crown for restoring this tooth. So this treatment is considered more conservative compared with indirect crowns. Sometimes the class 4 come as a fracture, as I say. Sometimes the class 4 come as an extension of a class 3 with some caries. Sometimes we will have a defective teeth structure, hypomineralized teeth, so they have a missing part on the incisal area. So all of those types of defects can be restored with composite restoration. We will use the same Miller strip and wedge for class 4. Usually we need to place adequate bevel, and this bevel, as we say before, it could be very wide in class 4 compared with the class 3, and usually we use the finishing pair like the flame shaped pair to place our wider bevel, and that can be extended between 0.25 to 3 millimeter. After that, we will start our etching, the same steps, same time according to the manufacturer instructions. Then we will place our bonding agent, also the same according to the instructions from the manufacturer. Restoration, the same, you will use the Miller strip to contour your restoration. You might need to place the restoration in increment depending on the size of the cavity. You will hold the Miller strip between your hand and pull it as tight as possible on the cervical area to take the contour of the missing part of the tooth structure. And then you will light cure each increment alone, and finally you will have your final restoration. Sometimes we have a large class 4 and we can do it in 2 steps. Instead of doing it directly, we can take an impression for the patient and make something called custom lingual matrix. And after that, we will use this custom lingual matrix to restore our tooth. And the exact steps of that you will take first an impression for the patient, and then we will have a cast, as you see in the first photo starting from the left side. This is the cast, and we make wax up for the fractured area or the fractured class 4 area. Then after we make our wax up and we are happy with the shape, with the final shape, then we will use silicone material, heavy body silicone material, and then we will take impression of the lingual surface, and this is the lingual matrix. This is the custom lingual matrix. In the purple color. After that, we will bring the patient again and place this lingual matrix on the lingual surface, and then we will use it as a matrix for us and build the lingual surface, and then we will use the Miller strip to build the proximal and the labial area, and finally we will finish our restoration. So this is indirect direct technique, and the first one that we speak about is the direct technique. After that, you will finish the class 4 as you finish the class 3. You can use finishing burrs, stones, hand instrument, discs, a scalpel, whatever present in your instrument kit. And after that, for class 4, it's very important to do your assessment. You should see the incisal edge length and thickness and make sure that it's mimic the adjacent tooth. And you need to check the occlusion with the opposing teeth for both class 3 and class 4. You should see if you have any high contact, you should remove it. You can use the articulating paper to check the occlusion and correct anything missing. If you have any underfilling, you can add more to the composite. If you have overfill, then you can remove more with using the finishing and polishing paper. Inshallah, all of those steps should be done in the lab. So the instructor will make some or small